Okay, hello everyone. Thank you for coming this evening. I'm Jamie Simmons. I work for Every Child. I'm in the engagement department, along with Sydney Rabinovitz is going to be running tech tonight. She's the logo. But we are excited that you're here with us this evening for our final Parent Up of our season about eating disorders. We are lucky to have Kristin Burmeister here from the Emily Project. She's going to get started in a moment. As always, if this is your first one, you might not know this, so I'll kind of go over what we do. We'll have the guest speaker speak, and then you're welcome to put questions in the chat at any time. Sydney and I will be monitoring that. But you're also welcome just to unmute yourself and ask any questions. And then of course, there'll be question and answer time at the end. Also, one last thing, I'm not usually the person that facilitates this, so I need to make sure I get my checklist right. We just want to thank NAMI Keystone for being the sponsor of this program and allowing us to put this on throughout the year. Look for next season, I guess, to start in the fall. Kristin, it is all yours. You can take over. I'm going to mute myself and take myself off video. So there you go, Kristin. Thank you.
All right, thank you. So just a brief introduction on myself. My name is Kristin Burmeister. I am a licensed social worker and program therapist for the Emily program at our Cleveland site, actually. So I work in a level of care called partial hospitalization, which is also shortened to PHP, which basically just means I work with clients for a day program that runs from about 8 to 2, working with eating disorder treatment. So we do lots of groups. They have a variety of different appointments they go to that we'll talk a bit about in this presentation. So I've been at the Emily program for about 3 years now. I worked at our residential for about a year before I transitioned into this role with adults. So I got experience across the lifespan as well. So we can go ahead and get started. So the title of the presentation for today is Understanding Eating Disorders, or also known as ED 101. So I'm going to go over our objectives for today and get that pulled up. So really what we're looking to do in this session is first identify the differences between disordered eating and eating disorders. So this is a pretty common concern to come up, especially with adolescents and kiddos. There's a lot of dieting, a lot of disordered eating that can occur that maybe isn't an eating disorder, and sometimes it can develop into an eating disorder. So it's a pretty blurry line between the two, but we're going to talk a little bit about that. We're also going to talk about identifying the warning signs of eating disorders and different eating disorder behaviors. So there is a wide spectrum of different warning signs and behaviors you might see with eating disorders, so going over that. Learning a little bit about the etiology of eating disorders. So basically like kind of where do they come from? Why do some people get them and others don't? And learning a little bit about eating disorder treatment options. So if this is something that after this presentation, you're like, oh, this might be something that's impacting my kid or impacting somebody I know, kind of just talking about what are the treatment options, what are the things we can do. And of course, there'll be time for questions and answers at the end, or I'm open to getting questions throughout. All right. So I don't know if people are able to participate a little bit, but I wanted to start this off with a question, if anybody's willing to unmute and answer. So what do you think of as disordered eating behaviors? Like when you hear that term, what comes to mind? Or you can put them in the chat.
I simply think of not eating proper meals throughout the day, or like very scattered meals.
Yeah,
or
I think that's
meals throughout the day.
Yeah, so kind of having like that scattered eating pattern, or not eating like full proper meals, like maybe having really small portions. It's definitely something that comes up a lot. Any other ideas?
Binging.
Yeah, binge eating can be another one, which we will definitely talk about. So like the spectrum of maybe not eating enough, maybe eating too much, lots of different things can come up. So see a couple people sharing on that. So there are a lot of different things that we can consider disordered eating behaviors. So this is a non-exhaustive list, but ones that we pretty commonly see. So in general, we can think of disordered eating as basically anything that's deviating from more of like an intuitive eating stance. So kind of eating when you're hungry, stopping when you're full, just kind of following your body's cues to know when and what to eat. Anything that's kind of putting rules and boxes around that or getting kind of chaotic around that is usually where we see some disordered eating coming in. So this can include things like fad diets. So this is basically any diet under the sun that has some kind of name and set of rules with it. So this could be like the keto diet, the Atkins diet. There's a bunch of different ones out there. This could be like clean eating. So maybe trying to like cut out certain food groups or really focus on only eating like healthy foods. Doing things like cleanses. There's juices that sometimes go with that or different things like that. Singular or multiple food elimination for unclear or untested reasons. So it's really just a way of saying when someone is cutting out a specific food item or a food group for a reason that's not like a health issue or a allergy. So it's not like I'm cutting out gluten because I have a gluten allergy, or I'm not really going to eat dairy because I'm lactose intolerant. It's more like I have some judgments about carbs, so I'm not going to eat carbs, things like that. Also with disordered eating, we often see this preoccupation with eating, weight, shape, measurements, appearance, or activity level. So basically just spending a lot of time thinking or focusing on those different kinds of things. So focusing a lot during the day on what you're eating, what you weigh, what you look like, weighing yourself often, measuring yourself often, things such as that. Sometimes with disordered eating, you will see encouragement of others to eat in the same way. So this is especially prevalent with social media. So being like, I'm eating this way, other people should. So sometimes this might come out as like a kid trying to get a sibling or a parent to eat in a similar way, or trying to get the whole family to be on some kind of diet, things like that. Also can include things like skipping meals, so refusing to have breakfast, lunch, or dinner, things like that. Self-induced vomiting or purging, so basically doing anything that's going to make you sick and being able to throw up food as an idea of like, this will compensate for what I ate a lot of times. Laxative use, supplement misuse, diet pill use. This unfortunately is getting to be far more common. Again, with just the internet, you're able to order anything you want basically off of like Amazon or other things like that, or just buying them in the store. So using those things in a way that's not intended to. So using laxatives frequently, or trying like weight loss supplements, things like that. Any kind of odd behaviors around food or activities. So basically just like things that you wouldn't normally see or aren't typically for your family. So like tearing food up into little pieces, eating things that are typically things you eat with your hands, like a sandwich with like a fork and a knife, different things like that. Sometimes this comes with a social media emphasis on appearance, weight, shape, or measurements. So seeing someone constantly posting about like their weight, what they're eating, different things like that. Sometimes this can include eating in secret, and a lot of the times this also can lead to isolation, or sometimes it can become more of like a secrecy thing, like trying to hide these different behaviors. So unfortunately, these are all pretty common things for people to do. Like I would say most, especially like adolescents, are going to dabble in one or two of these things at some point in their lives because their friends are doing it, they see it online, they're like, I'm going to try this out, I'm going to see what this is like, I'm going to play around with this. However, not everybody is going to develop a full-blown eating disorder, despite a lot of people doing these different kinds of things. So when does it become an eating disorder? What's the line between I'm doing some funky things with my food, it's not exactly a normalized eating pattern, or like I've been on a diet for a little bit, versus I have an eating disorder that really needs some treatment and attention? So there are three main questions that we are going to ask ourselves as providers to identify the difference between you've got some disordered eating and you have an eating disorder. The first, is there a pattern of behaviors? So we're focusing on how often is this happening and how long has it been going on is a really big part of this. So for example, if we had a kid come in for an assessment and it's like really worried, they've been on a diet for like 2 weeks and they just seem really focused on it, that might be something that warrants like having a conversation about or checking in about, but it's not a very long time. And for a lot of especially kids and adolescents, they'll kind of drop that over time. So it's pretty common for kids to be like, I'm going to go on a diet, or I'm going to start working out a little bit more. And maybe it's really intense in the beginning and then it kind of peters out a little bit as they just kind of stop thinking about it as much. Or maybe they try out some diet for a couple of weeks and then they kind of get bored of it, or they're kind of like, I don't really like doing this, it's kind of annoying. And then they kind of go back to their normal eating pattern or something close to it. As opposed to somebody that has an eating disorder, we're going to see this going on consistently for a while. So usually at least like a couple of months, if not longer. So seeing consistently having these different behaviors around food for a frequent amount of time often. So like every day for a couple of months. So something like kid cut out carbs 3 months ago and it's getting more and more intense, and like they're cutting out other foods and it's going on for a while and it just seems like it's becoming a pattern. That for us is going to tell us that it sounds like this disordered eating is moving into an eating disorder. The next question we ask is there preoccupation? So eating disorders are a mental illness. There is a very big mental component to it, along with the different behaviors that we see. So for those with eating disorders, you're going to see a lot of their thoughts are consumed with thinking about eating, food, weight, body image, different things like that. So for somebody that's experiencing more of disordered eating, we might see like, yeah, I think about this diet thing occasionally, but it's not really the focus of my day. I can focus on other things. I can participate in school, and like it just kind of comes up occasionally that I think like, oh, maybe I should be following this. As opposed to someone with an eating disorder, it would be like, I spend all of my time thinking about this. I'm in the middle of math class and I can't stop thinking about what I ate for lunch because it was more than I thought I should have. Or I'm constantly like trying on different clothes to see how they fit and body checking. And it's just taking up a lot of time in their mind and in their day. So one of the questions that we actually ask in our intake process is like, what percentage of the day do you spend thinking about food, shape, or weight? And it's pretty common for the clients that are coming in with an eating disorder for that to be like 60, 80, 100% of the day. Sometimes people say over 100% of the day because that's all they can think about. So that mental component really comes in with the thoughts really being locked in on just focusing on having these behaviors, making sure that you can meet all of these different regimens and rules that go with eating disorder thoughts. And that's where we really see one of the big differences come in. And the last one is there impairment? So with all mental health diagnoses, we need to see some kind of impairment, basically meaning it's affecting your life in some way, and it's a negative impact that treatment can help with improving. So for example, like someone with disordered eating might say like, yeah, it's a little annoying sometimes, but to be on this diet, but if I really want to, I just like go off it. I hang out with my friends still, I'll still go out to get ice cream with them. Like it's really not impacting my life that much. For someone with an eating disorder, however, we're going to see that kind of overtake their life. So if you're spending all of your time thinking about eating, food, weight, that's usually going to have a pretty big impact on a lot of different areas of life. I would say for our adolescent clients, the most common area of impairment we see is the social aspect of this. So we are very social with food as humans in general. So it's very, very hard to have a social life and engage with that when you're avoiding food or feeling very anxious and overwhelmed around food. So it's pretty common for that impairment to come in with the adolescence of like, I'm not hanging out with my friends as much anymore. I'm avoiding social gatherings because they involve food. Or sometimes this can also show up with academic impairment. So things like I can't focus enough in class anymore. So I'm like falling behind in my classes. You might see their grades change. Or noticing that there's physical impairment a lot that comes with eating disorder behaviors as well, whether that's, having poor nutrition, different things like that, which we'll go over in a little bit. So those are the main questions that we're asking ourselves. So altogether, if we see all of these three things being like, yes, there's a pattern of behavior, they have got this preoccupation, there's some kind of impairment, then we're going to say, yeah, this is some disordered eating that's morphed into an eating disorder and is a problem that we should probably address. All right. So this chart also just goes over kind of how we might see this flow from one area to another. So you can kind of see how things can go from being healthy or kind of normalized for someone and moving into this problematic eating disorder area. So some different things we're looking at. So adequate nutrition. So if someone's doing well, they're healthy, they're doing pretty normal, we'll see that they'll have adequate intake, meaning like they're eating enough for their body, they're fueling their body, that kind of thing, and they're eating a variety of foods. That's something that we really pay attention to in the eating disorder world. So you're able to eat a variety that's pretty normalized for you, you're getting in enough. Moving towards more of the like problematic or red flag area, we might see some dieting, restricting, or just generally changing how you eat. That's definitely might just be more of like a disordered eating thing, but if it continues or worsens, we're going to be seeing maybe more of an eating disorder. So that can move more into like having an inadequate or unbalanced intake, so not eating enough or eating kind of chaotically. And then more on the problematic end, like definitely moving more into an eating disorder kind of realm, we see you're consistently undernourished or your eating is pretty consistently chaotic. So if we see someone getting into more of a like binge purge or binge purge restrict cycle, we might see someone restricting most of the day, then having a binge episode, then purging or maybe not purging, but generally seeing that like chaotic eating or not eating enough and being undernourished. Also with eating disorders, we do sometimes see physical activity or exercise being involved in the behavior. So this is not always going to be a thing. I've had clients before where exercise is not anything they ever thought about with their eating disorder. And I've had some clients where it's like their main behavior. So for a healthy individual, we're going to see appropriate balanced physical activity. So basically like doing whatever feels best for you, whether that's being on a sports team at school or doing yoga every so often, or just kind of playing around with your family in the backyard, going for walks when it's nice out, just basically whatever meets your needs best. Moving more into the problematic area, we might see minimal or excessive activity or a lack of or obsessive activity. So basically either moving into an extreme of I'm moving all the time, I'm exercising all the time, getting really regimented and rigid about it, or kind of avoiding exercise sometimes as a behavior. And then in a definitely more eating disordered problematic side, we sometimes see something called REDS for short, or relative energy deficiency in sport, also known as the female athlete triad. The relative energy deficiency in sport is a little bit more inclusive because this can happen with males as well. But basically what we see here is with the combination of overactivity, like exercising too much and not eating enough, there's a variety of health problems that can come up with this that are important to look out for, especially for teenagers. So we can see things with this. The main three we're looking at is there's an energy deficiency, so not eating enough, not getting enough nutrition, having low bone mass, and having some kind of menstrual irregularity. So like for females, like losing their period, that kind of thing. So symptoms with this could be amenorrhea, or that loss of period, dehydration, hypothermia, so feeling cold all the time, a lot of stress fractures or other overuse injuries for anybody that's an athlete or doing a lot of activity, seeing that weight loss or other eating disorder behaviors. So when we get this excessive activity paired with the other eating disorder behaviors, it can get to have a lot of physical illnesses or ailments that come with it. So it's definitely something we're also paying attention to. So moving on to our next category, we got body image. So for the healthy range, we see body neutrality and or body acceptance. So it's totally normalized to have some poor body image days, maybe have times, especially with, again, kids and adolescents, where maybe their body image isn't as great, or maybe there's something going on with friends or social media that's just like, I don't really feel that great about myself. But for most people, that's something that you kind of just, maybe you have a bad day, you move on. It's just kind of something that fluctuates or tends to stay pretty neutral, or maybe even a little bit positive. Moving more into the eating disorder realm, we see getting maybe like a little bit mild body dissatisfaction, moving more up to a moderate or severe body dissatisfaction. So the differences between those are really like, how much is this impacting your day-to-day life? And also how much is this tied to your self-worth or your self-esteem? So if we see somebody that has like maybe a mild body dissatisfaction, I'd be like, yeah, I don't really love my body, and like, it's not really like my favorite thing, but I can kind of sit with it. It's all right. I'm not really doing anything drastic about it, or I'm not, having it affect my everyday life. And if we have someone with a severe body dissatisfaction with an eating disorder, we're going to see all of these behaviors coming out, and it's going to be something that takes up a lot of their time. They're thinking about it all the time. And it's also something that's very impactful for how they feel as a person. So it's like, I feel like I have very low self-esteem because I really hate my body, or I feel like I'm not good enough because I hate my body so much. It's kind of like who I am and what I look like became the same thing all in one. Moving on to our eating behaviors. So for a healthy individual, we're going to see pretty regular eating patterns. There might be periods where things get kind of irregular because of maybe you're traveling, or maybe there's a stressor going on, or maybe you're trying out a diet and it's just something that gets let go of a little bit later. But in general, it's pretty normalized for that person, like historically pretty common for how they're eating. Moving more into the eating disorder, we're going to see things get more erratic, basically. So introducing some of those disordered eating behaviors we talked about, and those increasing in frequency and severity. So moving from like maybe occasional things like binge eating, restricting and purging. And then when we're seeing an eating disorder definitely emerging, we're going to see regularly occurring eating disorder behaviors. So frequent restriction, frequent binge eating, frequent purging, things like that. And then lastly on this, we have weight status. So something I always like to note before I talk about this one, contrary to probably common belief, individuals can have a very severe eating disorder at any weight, and sometimes it doesn't change their weight. So I know it's a pretty common thing for people to think like, oh, eating disorders are just like people who are underweight or people that lose weight. That's actually not true. Statistically, only 6% of people with eating disorders are underweight by BMI. So actually, most commonly, people are going to be at a quote unquote normal weight. And for some people, there will be weight loss or weight gain. And for other people, their weight will be stabilized. It just all depends on their behaviors and how your body reacts to it. So the body's a pretty resilient thing. A lot of times you can have a lot of these behaviors and it will just kind of hold you at the same place, doing a lot of different things, just trying to like preserve you. So for some people though, there will be some weight changes that come with the eating disorder behavior. So for a healthy individual, we're going to see a healthy body weight for that person, which we will talk a little bit more about in a little bit. But for becoming more into an eating disorder or becoming more of a problem, we're going to see some kind of intentional weight change or weight suppression. So intentionally doing something that causes weight loss, like restriction or some of those other behaviors, and moving more into intensive weight suppression or a lot of weight swings. So it really just depends on the behaviors that people are having. With restriction, we might see some of that weight loss. For people who are binging and purging, they might kind of oscillate in between different weights a lot. For people who are binging, their weight might go up, and for some people, their weight won't change at all. Alrighty. So something that we also like to talk about when going over the impact of weight and things like that on eating disorder diagnosis is reminding people that healthy weight is a very individualized thing. So you can appreciate that in our current society and culture, it's pretty common to get a lot of things thrown out about what weight is healthy and what weight you should be and different things like that. However, this is going to be individualized to every single person. So BMI is not the most accurate portrayal of what a healthy weight is. Unfortunately, it's really was made with the intention to be more of a statistics kind of thing rather than an assessment of health. So what we're looking at when we see clients to assess what their best weight is, isn't like a BMI chart or some kind of magical thing that's going to tell us the best weight for any person at any age. We're going to look specifically at their history. So for what I do in my role partially is being able to help a client if they need to gain weight, if they've done weight suppression over the course of their eating disorder, is getting them back on their growth curve. So something that we are always looking at with clients that come into our care is their growth charts. So you're probably pretty familiar with this when you take your kid into the pediatrician. They're like, this is how their growth chart's looking. They do them for height and for weight. So as you can see on this little image here, it's always going up. There's always growth and development happening from when a kid's born to about, I think growth curves go up to like age 20. So it kind of has a steep increase through puberty and then kind of tapers off a little bit as they get older. But generally, we always are seeing kids gaining weight. There's really not a reason that kids should be losing weight most of the time. We just want to see them stay on their growth curve. So if we have a kid come in that was on the 50th percentile growth curve, we're going to get them back to that 50th percentile. If they come in at a higher percentile, we're going to put them back to that higher percentile. Because basically what this information is telling us is that's where their body wants and needs to be to function best. So again, it's super individualized. There is also, I'll just put this in the chat if people want to watch it later. There's a video on the PowerPoint that goes over a little bit, just like explaining a little bit why it's helpful to not just have like one overarching rule that we have for everybody's weight, everybody's body size, because it is super individualized. So just something to be keeping in mind for this. All right. So moving on to some signs and symptoms of eating disorders. So we already went through a few with some of those disordered eating behaviors. Those might be some of the eating behaviors that are seen with eating disorders. But we see a lot of different kinds of symptoms and signs of eating disorders because they tend to affect basically the entire person. So there's really not something in your life that the eating disorder usually doesn't touch, just because it's so impactful on not only your mental health, but also how you're acting and your behavior. So it tends to have impacts across the board. So we usually break this up into physical, behavioral, and emotional signs and symptoms we can be looking for. So for physical, these are really going to be the physical effects of those behaviors. So they vary a bit depending on the behaviors, but pretty common ones include things like unusual and rapid weight fluctuations. So things that you can't really explain, you don't really know what's going on, like sure, if your kid's sick for a little bit and maybe their weight goes down a little bit, or they get like their tonsils removed and they can't eat as well for a little bit, that might be something you're like, yeah, I can see why that's happening. But it's kind of like, I don't really know anything that should be affecting their weight. And it seems like it's going down or it's going up, or it's kind of like moving all over the place, whether you notice that from, just observation, or if you're going into the pediatrician, you notice it's kind of going all over the place. Fainting, fatigue, low energy, interrupted sleep. So when you're not nourishing your body enough, it's pretty common to feel really tired, not have much energy. There's a lot of disruptions in sleep actually because your body's trying to wake you up in the middle of the night to go get food because you haven't eaten enough. So some of those definitely can be effects of these different behaviors. Gastrointestinal discomfort or dysregulation or some bloating. So a lot of different like stomach pain, complaints about that, like saying like I feel bloated all the time, or like I'm having different kinds of issues with kind of digestion stuff. A lot of the eating disorder behaviors affect the GI tract in negative ways. So restriction really slows down the metabolism and can have a lot of negative effects that way. Purging can have a lot of different effects on like the throat and things like that. Binge eating can also have effects there. So there's usually some kind of gastrointestinal impact with these behaviors. Things like dry hands, hair, poor circulation. So again, just symptoms with especially restriction of your body not getting enough intake. For biological females, disruption in their menstruation. So something that can also happen here to keep in mind is sometimes there's a lack of having a first menses. So if you have a younger teenager and, doctor or just from your own history, you're thinking like, yeah, they should be getting their first period around like age 11, 12, 13. It could vary by different people, but noticing that that's not happening, or it starts and then it suddenly stops for a few months, is possibly an indicator that there's something going on with nutrition or possibly an eating disorder. Chest pain or heart palpitations, there are a lot of different cardiac effects that can go on depending on the behavior. So any kind of odd cardiac events that are not explained by another condition. For those who are purging, throat irritation, or dental problems, we actually pretty commonly get referrals from dentists because they can pretty clearly see when the enamel is eroded on your teeth from purging a lot. So if you're noticing like complaints of toothaches or complaints of your throat hurting, that's really like that acid in your stomach is not supposed to be coming back up in your throat or on your teeth. So doing that a lot is going to break down a lot of things there and not be very good for either of those areas. And an increase in bone fractures in pretty extreme cases. There is a lot of negative effects with especially restriction on your bone health. The one thing that I will say that the impact that eating disorder behaviors have physically usually can be corrected or treated just by treatment with increased nutrition, stopping behaviors, things like that. The one thing that we can't reverse in adults is the impact on bone mass. Like by the time you get to your mid-20s, it's kind of like if you lose it, you lose it. There's not much you can do. The great thing with kids is that because they're still growing and developing, there actually is a chance that we might be able to repair some of that even because they're in a stage where they can still be growing and developing their bones. So that's another reason that's really important to be able to recognize these things early and get on top of it, just because a lot of these physical things can become really serious and scary if they go on for a long time. But if we get treatment early, especially in like the adolescent years, we can get them back to like a good healthy state that they were at before the eating disorder. So we also have behavioral signs and symptoms. So that includes things like dieting or chaotic food intake. So being on any kind of super rigid diet, whatever it may be, or just kind of noticing that food intake kind of seems all over the place. Preoccupation with food, weight, size, and shape. So spending a lot of their time thinking about that, spending a lot of their time talking about that, noticing that like all of their social media is focused on this. They're looking up things all the time about these kinds of things. Noticing excessive exercise. So going from, being just going to your soccer practice and just doing that to like after soccer practice being like, I'm going to go run for an hour after every practice, or I have to do this extra conditioning, or suddenly having this really regimented exercise pattern that like nothing will get them to stop, like not injury, not trying to go on vacation, different kinds of things, like just not really letting go of it and being really excessive and rigid about it. You also might see frequent trips to the bathroom, especially after meals if a kiddo is purging. So if you notice that It's like every night after dinner, they like go to the bathroom, or they're showering always right after dinner. And that's not something that they used to do. And they seem kind of off about it, or it seems kind of secretive, or it just seems different. A change in clothing style. So depending on how the person's thoughts are going, sometimes it can be kind of to hide the body because of that body dissatisfaction or those negative thoughts about the body. So only wearing super baggy clothing like hoodies and sweatpants, even in the middle of summer, or just noticing that that's not like typically what they wear, but something changing to that. Or sometimes wearing things that are like tighter or more revealing to kind of like be like, oh, look, I've lost weight or my body's changed, that kind of thing. And also eating alone, isolation, or being emotional around food and meals. So noticing a kind of a shift in basically how they are at meal times. So whether that be, you normally sit down for family dinner and all of a sudden they're like, oh, I got to go do homework, or I'm really busy, or just like isolating and avoiding that, or getting really frustrated or irritated at meals, like kind of just start fights, walking away, that different kind of thing. So just noticing different behaviors, especially around food and exercise. And we also have emotional signs and symptoms. So these can include things like severe mood swings, especially with our adolescent and teenage clients. So one thing that we do know is that when you are not eating enough, when you're restricting, the first thing your brain says you don't need anymore, you don't need energy for, is your emotion regulation, because you don't need that to live. You need to be able to breathe, you need to be able to keep your organs running, but having stable emotions is kind of a luxury to your brain when it's not getting enough. So the first thing it's going to do is say like, okay, we don't have energy for that. We need to preserve it for what keeps us alive. So it's kind of like adolescent mood swings to the max. So being really irritated really is super common with kiddos, especially with the eating disorder, just noticing that like mood just seems to be a lot more volatile. Increased isolation, irritability, or anhedonia. So noticing like spending more time by themselves, things like that. Eating disorders tend to be very isolating and secretive disorders. So trying to hide away the behaviors, trying to hide the self away, just trying to like disengage from people because of feelings of shame, or just trying to hide behaviors definitely are warning signs. Low self-esteem or complaints about one's body. So noticing like exceptionally low self-esteem, especially tied to appearance. So having a lot of comments like, oh, I wish I, could wear something different, or, I don't like how my body looks, or I don't want to go out, I feel gross. Like just kind of noticing more negative comments about their body or more negative comments about themselves overall. Noticing an increase in perfectionistic tendencies. So for a lot of individuals, getting really rigid and regimented in their eating can kind of overflow into the rest of their lives. So noticing things like always have to be the same way, they have to be perfect, I have to get perfect grades, I have to eat perfectly, different things like that. Seeing sadness or comments of feelings of worthlessness, so maybe seeing some depression stuff coming up or different things like that. We also a lot of times see anxiety or obsessive compulsive symptoms come up. So it is pretty common for other mental illnesses to come up along with the eating disorder, either before or during the course of the eating disorder. So most commonly that's going to be things like depression, anxiety, or some OCD type things. So noticing an increase in those symptoms or a change in those symptoms, if that's something that historically your kids struggled with. And occasionally in some situations, we might even see some suicidal ideation coming up. So this is a pretty significant mental health issue that sometimes can get people into a pretty dark space in their head. So sometimes we will see that suicide ideation either starts to come about or gets really intense with the eating disorder, just because it's not a very happy way to live your life. And a lot of times, sometimes it just seems like, I just want this pain to end and I don't know how else to do get this to end. So those are all things to be looking out for. All right, so briefly going to go over the different types of eating disorders. So we have a variety of diagnoses that we look for with eating disorders, and they're basically just categorized by common behavior patterns that we see depending on how an individual is experiencing their eating disorder. So the first one, and one that people probably most commonly know, is anorexia nervosa. So this is when you see that main behavior is restriction of food intake. So in this, you're going to see restriction of that nutritional intake, leading to some kind of low body weight or failure to meet growth trajectories. So basically what that means is either someone's losing weight or they're not gaining weight as they should be. So I've had a number of clients where they didn't lose any weight, but they also didn't gain any weight from age like 11 to 13, when you're usually gaining quite a bit of weight with puberty. So basically just seeing someone fall off their growth curve is a really big sign for anorexia. With the mental piece of this, we see an intense fear of food and weight gain. So having that very intense anxiety around eating and the idea of gaining weight. There's a disturbance in body perception. So people tend to think that they are bigger or look very big than they are, different things like that. And for anorexia nervosa, it may include some binge eating and purging behaviors, but pretty infrequently or not super frequently. So again, for anorexia nervosa, we're really seeing that main behavior of restriction along with that anxiety around food and weight gain. Next, we have bulimia nervosa. So for this one, the two behaviors that we're usually seeing are binge eating and purging. So binge eating in the sense of eating disorders is when you are eating a large amount of food in a short amount of time and having a sense of loss of control. So this is not like I went to Thanksgiving and ate a little bit more than I was comfortable with. For binge eating, it is like a definable, like, I really don't feel like I have any control over this. I'm eating a very, very large amount, like more than other people would eat in a similar setting, a similar circumstance, and just feeling very out of control with it. So with binge eating, we see both objective and subjective binges. So for an objective binge, it's like most people would agree that that was like a lot more food than an average person would eat in that circumstance. And you had that loss of control. For a subjective binge, we would see like that person felt that loss of control, but it wasn't actually like a large amount of food for the setting that they were in. So with bulimia nervosa, we're seeing those objective binge eating episodes followed by some kind of compensatory behavior or purging. So this most commonly is self-induced vomiting, but it also can include things like misuse of laxatives, misuse of diuretics, using diet pills, excessive exercise, being like, gosh, I just binged, I have to go like run on the treadmill for 2 hours, or being like, I'm going to take 10 laxative pills or whatever it might be. And also with bulimia nervosa, we see that self-evaluation is unduly influenced by body weight, shape, and size. So basically seeing, again, that kind of self-esteem is tied into appearance really heavily. Next, we have binge eating disorders. So binge eating disorders when we just have that binge eating and it's not followed up by a compensatory behavior. So something to note with this is that for a lot of people with binge eating disorder, they might have some episodes of like some restriction to try to avoid a binge, different things like that might get locked into different cycles around that. But again, the main behavior with binge eating disorders, we're seeing just those episodes of binge eating and there's not super frequent other eating disorder behaviors. Next, we have avoidant restrictive food intake disorder, also known as ARFID. So this is a failure to meet nutritional energy needs due to an eating or feeding disturbance. So the way that I usually explain this is anorexia is restriction based in wanting to lose weight or having this fear of weight gain. It's more about like the effects of eating are scary to me because I think I'm going to gain weight or something's going to happen in the way I look. For ARFID, the focus is more like something about the process of eating is what's giving me anxiety and making me nervous. Like I'm not, really linking this with body image or the way I look. So some examples of this might include for people with sensory sensitivities or different sensory issues. This is a pretty common diagnosis that comes along with things like autism spectrum disorder. So just being like, I don't want to eat certain foods because like the texture is weird or the taste is really overwhelming. So I'm going to limit to like 3 different foods that are safe for me that I'm okay with. Or other things that we sometimes see with ARFID is like, let's say someone had an episode where they experienced like a near choking type thing. And then afterwards they're like, I will only eat like drink liquids or eat really soft foods because I'm terrified that I'm going to choke again. So it's not really the anxieties coming from like, I don't want to gain weight or different things like that. It's more like something about the process of eating is giving me a lot of anxiety. And actually commonly with people with ARFID, we might even see that the low weight or the weight loss is disturbing to them, like they don't like it, they want to gain weight, different things like that. So again, this is going to be associated with some kind of weight loss, a lot of nutritional deficiencies, or failure, again, to meet those growth trajectories. And then lastly, we have these other diagnoses that include other specified feeding or eating disorders, also known as OSFED. So for OSFED, this basically means like you don't fit into the boxes of the other diagnoses, but you definitely got an eating disorder going on, and the behaviors are just kind of a little bit more chaotic. So these might be things like purging disorder, where someone's only doing purging behaviors, they're not binging, or maybe they're restricting a little bit, but it's mostly just purging. Or atypical anorexia and bulimia. So for atypical anorexia, maybe you have all those behaviors and the mental part of it, but the weight loss piece isn't having an impact yet. So we can't officially diagnose anorexia. There's also like low frequency or low duration things. So maybe you don't quite meet the like timing criteria of things. So again, that's kind of like a catch-all diagnosis of, we know there's an eating disorder going on. We know that this is definitely something that needs attention and treatment. It just doesn't fit into these other boxes. So this is the diagnosis we're going to go with. I will say in my experience, OSFED is a pretty common diagnosis. I would say at any given time, half or more of my clients have an OSFED diagnosis, just because people tend to have a lot of different eating disorder behaviors and tend to go between different ones. So it's relatively uncommon for people to just stick with like, I just restrict or I just binge and purge, that kind of thing. Usually it's a little bit more all over the place. And lastly, we also do have an unspecified feeding and eating disorder diagnosis, but that's usually only used in like an emergency room kind of setting. It's just kind of like, I know there's an eating disorder, but I don't have enough information to know what it is. So that's not one that we use, because in eating disorder treatment, we're going to be asking those questions, figuring out what specifically is going on. That might be something that comes up if it's like a emergency situation. All right. So moving on to a little bit to why people get eating disorders, or kind of where these come from. So a really common question we get is, why do only some people get eating disorders? Like, a lot of people mess around with their food, a lot of people diet, a lot of people do different things. A lot of people experience the same like social and cultural kinds of pressures on appearance and eating. A lot of us see the same social media, but it's relatively uncommon to get an eating disorder. Why is that? So overall, for eating disorders, we have to see this kind of perfect storm come up, basically meaning that there's a lot of different factors that go into creating an eating disorder. It's not like you just change how you're eating one day and then it just happens upon and turns into an eating disorder. We got to see a lot of different things coming up. So when we have somebody with a genetic or biological predisposition that is triggered by an experience or the environment, an eating disorder results. So basically what we see is that you need some kind of genetic or biological predisposition to be developing this. And then something happens that changes the way you're eating, and then it kind of gets locked in by that genetic component, and then it develops into an eating disorder. So if you don't have that genetic or biological predisposition, dieting, doing different things with your food isn't going to turn into an eating disorder, because that part isn't there. Or someone could have the genetic biological predisposition and maybe something just doesn't happen to have that turn into an eating disorder. They might live their whole lives without an eating disorder. So it just takes a lot of factors all falling into place at once. So this is kind of the model that we use when we're talking about where eating disorders come from. So different factors that play into this, again, are the environment, biology, and different kinds of experience, traits, or psychology. So for the biopsychosocial model, we see biology, psycho, kind of psychology, how your thoughts are, your traits, and then social, your environment. So for biological influences, we have your genetics. So for people in the family with an eating disorder, whether that's known or unknown, dieting and different food exposures. So for a lot of people, the way that you're eating or dieting or restricting kind of set off different biological predispositions and change things in that way. And also puberty and menopause. So with the hormonal changes that come with puberty and menopause, those kind of phases of life, we see an increased incidence of eating disorders just because those changes bring out a lot of these different kinds of things. So that's why it's pretty common for eating disorders to start in the teenage years. We also have different experience and traits. So like if you have anxiety or depression, if there's substance use problems, just having a lot of stressors, thinking of things like the pandemic or other things that might be going on, school stress, other things, bullying, other traumas that might come up. And then also environmental factors. So things like what you see in the media, weight and appearance pressures coming from a lot of different sources, or weight comments or teasing around that. So something to keep in mind is that if you were to take like a triangle and create it so it would fit in the middle of all of these three bubbles, you could move it around a lot and still have the triangle fit in all the bubbles. So it's going to look different for everybody. For some people, this is like a really biologically based thing. Like they got a lot of genetic loading, and it's like the first time something kind of stressful happened, this is just how your brain reacted. It was like, do this with your food, it will help you feel better. And it just kind of turned into an eating disorder. For some people, maybe it's a lot of environmental stuff and there was just enough of that biological predisposition that it set off the eating disorder, or maybe it's a little bit more in experience. It's going to look different for everybody, but that's what we're generally seeing. The other thing I would like to point out is that there is no one thing that causes an eating disorder. So a lot of the times, especially when we have parents coming in, they're like, oh my gosh, is it something I did? Is it something I said? Like, what, did I do something wrong? No, there's no one thing that's going to create an eating disorder out of nothing. So, you know, we never blame any one person or any one thing. It's always a combination of things that we may or may know, may be able to identify, and sometimes we don't. And that's okay. We don't need to know every little part of what played into creating the eating disorder to treat it, but it is helpful to understand that this is a pretty complex disorder that is influenced by a lot of different things. All right, so moving on to what we can do in terms of treatment and what treatment can look like. So if you're thinking, I know somebody, or I think I know somebody that probably has an eating disorder based on this information, what do I do? So first, it's really important to get a comprehensive assessment for deciding, like, is this an eating disorder and what's the appropriate intervention? So most commonly, the best way to go about that is going somewhere like the Emily program or a different eating disorder treatment facility and getting a really focused assessment. So as much as a lot of my fellow mental health practitioners, this is a specialization for a reason. It's a really complex disorder that has a lot of things that a general therapist might not ask about or look for. So if this is something you're concerned about, you really need to be getting in touch with a specialist for it. Because if you went into a general therapist office, they might not ask all the questions, they might not ask about all the behaviors, they might not know what to look for, just because it is a specialty in the field. So generally, those who are struggling with an eating disorder are going to need a multidisciplinary team, including things like therapy, nutritional counseling, and medical care. So as we talked about in the beginning, there's a wide variety of signs and symptoms that come up with eating disorders. There's a wide variety of effects that these behaviors have. So we need a lot of different people to kind of help out and focus on the different areas it might hit. So a therapist might focus a bit more on those, you know, effects on the mental health, effects on your thoughts, things like that. And the nutrition people might focus a little bit more on like your behaviors around food, how you can improve your nutrition. We want to have that medical care to make sure that the medical effects of these behaviors are staying in check, that you're safe, that kind of things. The other thing we really do want to stress is do not wait. So even if it's just like, this could be just like a phase, it could pass. There's no harm in getting an assessment or just checking in about it, because waiting is just going to make it get worse. And the quicker we can intervene, the better, for a lot of different reasons. So first, we can avoid some of those negative physical effects. Again, luckily the body is pretty resilient and it's usually able to fight off having a lot of negative physical effects for a little while, but at some point, like, things are just going to start to break down. It's going to get pretty scary pretty fast. The other thing that we do know is that the earlier we're able to intervene, the better chance there is of a full recovery. So I've seen a lot of kids where they come into care and they've, you know, been having some eating disorder behaviors for like a year or maybe a little bit less, and we're able to get them in a really good place pretty quickly because it isn't as locked in. It's like, okay, you might be a little bit more open to changing, you might be a little bit more willing to do things differently, and we can get you to a good place with recovery. As opposed to when I worked at the residential with the adult population, I had people there that have had eating disorders for longer than some of my current clients have been alive, like decades. And while there is hope for them to recover, it's just a much more challenging thing. So the earlier that we can change things around, get them to normalize their eating patterns, get that care and support that they really need, the better chance it's going to have of being able to be something that doesn't get super severe and have a lot of negative effects, and can be something that the treatment might just work a little bit better because we're able to catch it sooner. So treatment options and levels of care. So what does treatment really look like? In a very brief overview, treatment can look a lot of different ways. So we have a variety of levels of care, basically matching the severity of the eating disorder and the needs of an individual to what treatment can look like. So we have things like residentials, which offer 24-hour care. So it's, you go to the location, basically live there for a few weeks, you have monitored meals and snacks. There's usually a lot of medical monitoring, there's groups, there's different therapies, and it's pretty intensive. So that would be like the eating disorder severity is pretty high. You need a lot of medical attention, you need a lot of monitoring. There might be a lot of weight gain needs, that kind of thing. Below that is our partial hospitalization programs, which is what I currently work in, or PHPs. So again, this is an outpatient day program. So it's usually about 6 hours a day, 5 to 7 times a week. So in that level of care, you're meeting for a lot of appointments, you're doing a lot of groups, you have some monitored meals and snacks, but there's an expectation that you're safe enough to like be home in the evenings. Like medical concerns are still there, but they're not as severe as they would be with residential. And you're able to do some of those meals and snacks with the support of family at home. Below that, we have our intensive outpatient programs, or IOPs. So those usually meet like 3, maybe 4 hours a day for a few times a week. I know our IOP meets 3 hours a week in the evening, 4 days a week. This oftentimes is like stepping down levels of care, a transition back into school, being able to get a little bit less support. Usually there's only like one meal or maybe a meal and a snack that's monitored in that. And usually at this point, maybe the medical monitoring could fall off a little bit. We're seeing a little bit more stabilization. And then also outpatient services. So that can be following up from having a higher level of care journey, like just making sure that those changes are staying in place, that you're able to continue on your recovery, or you can also start at any of these levels of care. So maybe if we're able to catch an eating disorder early, or it seems like it might work to do a lot of the work at home, we can do outpatient services as well. So again, often with eating disorder treatment, we're going to see a multidisciplinary team, meaning that there's a lot of different people involved to just focus on different effects that the eating disorder can have. So for residential and partial hospitalization, this typically always includes a therapist. So someone like myself that's going to do individual therapy or group therapy, or typically a mix of both. A dietitian, so someone that's going to be able to focus on how are we changing your nutrition intake? How are we making sure that you're gaining weight if you need to be gaining weight, or getting all of your dietary needs met, and being able to focus on how food and different behaviors around that can be modified and changed. A medical provider, so someone who's, again, assessing the different medical effects of the eating disorder behaviors and making sure that those are improving as treatment continues. And a psychiatry provider if needed. So for some clients, psychiatric medications can be helpful in recovery. For some clients, they don't want that, or their families don't want that, and that's totally okay. But also typically in our higher levels of care, they're also going to be checking in with psychiatry, just to be checking in again on like mood and safety stuff. So making sure we're checking on any kind of like self-harm, suicidality, things like that. So in combination, working on a team, we can get a lot of work done and a lot of treatment done with focusing on a lot of different effects and a lot of different areas of the eating disorder, and hopefully get people into a good place in their recovery. So for outpatients, sometimes people see all 4 of these kinds of providers. Sometimes it's just a therapist. Treatment's really just going to depend on what the person needs. So therapy models that are used in treatment include things like family-based therapy, or FBT, also known as the Mosley method. So this is a treatment method that is exclusively for children and adolescents, and research-wise is proven to be the most effective treatment modality for adolescents. So this is what we use at the Emily program. We use a modified version in higher levels of care. But basically the idea behind this is that parents are going to take control of the food, help re-nourish their kid, and then over time there is a planned out way for kiddo to get control of the food back when they're able to get into a more stabilized place. So we really utilize families in the treatment of eating disorders for adolescents and kiddos. So we really never blame parents. We think they're the best resource for these kids and can be very helpful in the recovery process. We also include some things around cognitive behavioral therapy. So focusing a lot on like, how can you change your thoughts, and how can you focus on ways to challenge some of those eating disorder thoughts and get your thinking into a more recovery mindset. And also dialectical behavior therapy, so known as DBT. So a lot of this focuses on different emotion regulation skills. So being able to have pretty good toolbox of a bunch of different skills you can use to help manage your emotions, try to change your way of thinking, and be able to use those skills to be able to get back to a normalized eating pattern and not have your entire thoughts process be taken over by thoughts of food, weight, shape, size, that kind of thing. All right. So treatment FAQs, so questions we frequently get about treatment. Where do I start? So everybody's going to start this process with an intake, which will determine if the individual has an eating disorder and the level of care needed. So I'm actually currently training on intakes. I'm a backup intake provider as well at the Emily program right now. So we have a pretty thorough intake process where you're going to get asked a lot of questions about like, what does your eating look like? What does, things What's that affecting? What behaviors are you having? How long have you had these behaviors? Also going into things around like general mental health and your physical health, and how are things with your family? So we ask a lot of questions. We can get all the information we need to see, okay, is this an eating disorder? What eating disorder is it? And then what is the kind of treatment you might need? So being able to give that recommendation of like, oh, this is really something that we need to go to residential for, or this is something that you could do in outpatient trial of, or you could try out outpatient, see how it goes. So where do I go to? So again, starting with an eating disorder specialist or program, we always want to recommend that if you think it's an eating disorder, seeing someone who is specialized in this or going to a specialized program is going to be your best bet because they know what's going on. What does treatment entail? So treatment can include multiple levels of care and multiple providers, and it's always going to take a good amount of time. So it's going to take usually more time than you've been sick to get into a different place with it. So for a lot of the kids I see, it might be like a year or two in treatment altogether. The higher levels of care are usually going to be like a few weeks, so like a few weeks in residential, a few weeks in PHP, a few weeks in IOP, and then usually a good amount of time in outpatient, where we're slowly, spreading out the appointments more and more. So maybe you're doing weekly, then you're doing every other week, then you're doing once a month. We just want to make sure that people are in a good spot, that they're ready, that they're not relapsing before we kind of like, okay, you're good to go and be out of treatment. Who is involved? So that's going to be the clients, maybe your kiddo, the family, and the providers. So especially with kiddos and adolescents, we're really going to see like the family is very involved in the treatment. How is it covered? That's going to depend a lot on insurance. So depending on the insurance you have and different things around that, it's going to look different, but we work very hard to try to convince insurance companies that this treatment is definitely very needed and get it covered as best as we can. How long does it take? Again, it's going to depend on the situation or the symptom severity. It's definitely going to take less time. The sooner we can intervene, the sooner we can get somebody in treatment, but it might take a really long time depending on the person. That's nothing negative to say about that person or their treatment team. It's just like sometimes this is just going to take a long time, be a long journey for people. When is it done? Whenever that person is ready to be done or their treatment team thinks that they're done. So it's really like when you're able to get into a good spot in your recovery, you feel like you have the tools you need to be able to go through a bunch of different stressors and go through your life and be able to manage it without these eating disorder behaviors. And a common question we get from our parents, especially with our adolescent kiddos, is how does this impact school? So most of our kids are able to keep up with their school requirements, and often schools make accommodations for students in higher levels of care. So if this is something that ends up needs to be something that you need to pursue, it's pretty rare for your kid to be the first or only one to ever have an eating disorder. So it's pretty common for schools to know kind of how this works and how they can accommodate for it. If they're in residential, PHP, IOP, they have to be out of school for a bit. So with the kids I work with, it's really common for them to have reduced workloads, kind of like getting rid of worksheets or different homework assignments and really just focusing on a couple of things, having extended due dates, having a tutor that might work with them after school hours if they're in treatment during school hours, and doing that schoolwork like throughout the day, being able to keep up with it. And then schools are usually pretty good about making a good transition plan for when they return to school with getting caught up, getting back into place. So I have had many clients in my treatment program throughout the school year. Most of them, their grades do not suffer at all. They tend to be doing just as well as they were before, sometimes even better because they're able to focus more, the brain's functioning a little better. So we do a really great job of being able to work with the schools to make sure that they're still able to engage in school in a way that's going to be appropriate for what they need to do for their treatment and be able to manage both at the same time. So how to refer. We have a couple of phone numbers that you can be calling. There are different forms that come up on our website. You don't need an external referral, like you don't need to see your primary care doctor first or go to a therapist first. You can just kind of give us a call and ask it like, hey, can I get an assessment? And the worst outcome of that is, there's two outcomes really that come with getting assessment. Either they say like, hey, this definitely is an eating disorder, let's figure out a treatment model, treatment idea. Or they say, I don't really know if this is quite an eating disorder yet, but here are some resources that you might be able to go to for a general therapist, or here are some ways that might be helpful to keep this from getting to develop to something more severe. So it's definitely a helpful thing to check in about if you do have concerns about this. And just a note on things that can be helpful for decreasing the risk of eating disorders and disordered eating. So again, parents are never to blame for eating disorders. This is not something that like just one thing can cause. However, there are some things that we can be doing that can be helpful with decreasing the chances of this becoming a problem. So doing things like focusing on health. So if you're noticing different things going on that you're concerned about, focusing on like, what can you be doing to help your body function better, help feel better, rather than saying lose weight or focusing on the weight. So instead of saying something like, oh, I think you like gained too much weight, let's go on a diet together and you can lose the weight. Saying things like, hey, like, let's try to be more active together as a family. Maybe we can go on walks, or let's try adding in more vegetables instead of like taking things away from what they're eating, just saying like, hey, let's try to add a couple of things in. And again, focusing on behavior. So losing weight again is not a behavior. Doing things like eating a variety of foods, moving in a way that's joyful to you, getting good sleep, and all things lead to improved health. So sometimes there are things that we're not even really considering that much that can have a huge impact on health, like your sleep, or being able to have good coping skills for stress can do great things for your health and may have nothing to do with weight. Encouraging family meals, especially important for our kiddos and adolescents. So being able, if you have time, if you're able to sit down as a family and have a meal together can not only just help having good family dynamics, but also gives you a little bit of an end of like seeing if eating patterns are changing or being different. So being able to sit down at least once a day and be like, hey, are you eating, full meal? Are you able to get through that? Is anything changing with that? Are you changing your eating patterns? Valuing all, so ensuring that the kiddos and the other people know that like you value them regardless of their weight or their health status or anything like that. Talking less, doing more, so not spending a lot of time talking or focusing about food and weight just because that can increase that preoccupation, and focusing more on doing different kind of behaviors. So again, trying to do things together. And rethinking judgment. So a lot of the times it's pretty common for our language about weight, our own, other people's, to be pretty negative, and weight stigma and weight biased and weight focused language in general are really prevalent in our everyday lives, and it can be pretty easy to get wrapped up in that, but doesn't make it very helpful. So trying to, check our own judgments, being able to just decrease comments about that, to generally kind of veer the focus away from weight and the negative judgments on that and be more neutral about it. All right, and then lastly, I will be sending out this PowerPoint in the chat in just a moment once we have wrapped up, but I do have some resources that are helpful in general. So some general information on eating disorders, you can go to the National Eating Disorder Association. They are a great organization. They have a wonderful website with a ton of different information on it. They got information on every diagnosis pretty much. They've got like a lot of blog posts that go over specific things. Also, the Alliance for Eating Disorders is a super great resource as well, just like general information. They actually have a resource library on there that has a lot of letters that you can use to talk to the school about different things. So if your school is assigning like homework that's really focused on counting calories or other things that maybe wouldn't be great for a kid with an eating disorder or with the potential of developing one, being able to know how to communicate with them, and also has a lot of other great resources just around eating disorders in general. We also have the Emily program website, which has not only information on the care and the services we offer, but again, general information on eating disorders, and also some resources, just support for caregivers of children or adolescents who are in treatment for an eating disorder, if that ever is to happen. Feast, so Families Empowered and Supporting Treatment for Eating Disorders, is a lovely website that has so much information with being helpful with going through the FBT process, having a kid in a treatment program. They actually have something you can sign up for called the first 30 days, and they'll send you an email every day for 30 days if your kid is in treatment. And the idea is that like, hey, it's giving you a bunch of little information tidbits over the course of that first month. We also have the Family Guide to Recovery, and we have a sibling guide as well on our website that just goes over a bunch of information that's helpful to families. And Project Heal is also a great organization that offers a lot of services around eating disorders and eating disorder treatment. So that is a lot of information, but that's all that I had for this evening. So I can send out this just in case people want to refer back to it, and I'm open to any questions people might have.
Kristin, first, thank you so much. I was just writing things down and jotting things down the whole time you were talking, and I can't wait. Yes, I can't wait to share the video of this with a lot of our clinicians and our caseworkers. I think that there's just some great information, and like you said, it's a specialty, and I know that they would love, they're always looking to expand their knowledge base. So thank you first. Thank you so much. I don't have any questions, and there are no questions in the chat right now, but please, does anyone on the line have any questions?
I just also wanted to say real quick, Jamie, thanks for having us. I'm Katie. It's coming up as Kristin because I
Hello, Katie.
Yeah, I'm Katie from the Emily program, and I apologize for being late. I had some things run over and then was like, is my day done? And then I was like, oh no, I'm late. So I apologize, but Kristin did a great job as usual, and I'm not surprised. But yeah, so there are a few questions popping up. And it looks like you also answered a lot too, so good.
How has the pandemic affected eating disorders? Oh, could talk another hour about this probably. So the short answer is it's definitely increased our eating disorder frequency. Especially working with teenagers, we just saw this like explosion, especially like a few months after the pandemic started. Few reasons for that. One being just like it's a lot of stress, going through a global pandemic. It's a very scary thing for everybody, and being isolated in the home. Like if you had a challenging family dynamics or just being away from your friends is like not a great thing when you're in your teenage years. Like that social development is really hitting off there. So being out of school with people for a year or more is very stressful, very overwhelming. The other unfortunate thing that we saw that wasn't super surprising, but not great, is that there was this big focus on like the quarantine 15 and like avoiding gaining weight in the pandemic. I was like, just try to like get through the pandemic. I don't need to worry that much about that, but okay. So we definitely saw a lot of increase in those behaviors, whether it's individuals who had an eating disorder relapsing, because it is a very significant stressor. That's the most common reason people relapse, is that some big stressor comes up in your life and you're like, I can't cope with this, but I know this behavior works really well for me, even though I know it's not good for me. And we also saw a lot of eating disorders emerge in that time. Like I know for me, it's not ever surprising to me when I see in an intake that like behavior started in like March of 2020. And I'm like, okay, well, we know what caused that to kind of pop off. So definitely when we talked early in the presentation about kind of that trifecta that we see of that environment, psychological factors, and your genetics, I feel like if you had the genetic predisposition for it, this was enough of a stressor, no matter how much or little of it was there, to kind of veer it off. So we have been seeing record numbers across our organization of needing care. I've actually, since I've started, we've opened 2 or 3 more PHPs and an IOP. So like we've been expanding services, and we still are oftentimes like having wait lists, things like that. So it definitely has increased the need for treatment and has increased the prevalence of eating disorders in a lot of different ways.
I think it's impacted everyone's mental health.
Generally, it wasn't a great for anyone's mental health. So if it came out in food or your body image or anything like that, it was pretty common for it to morph into something like an eating disorder.
Very much so. Any other questions coming out in chat?
And I know you guys are all in the Pittsburgh area, correct? Mm-hmm. So we do have a location in Wexford, Pennsylvania, that does a lot of outpatient work and really works with a lot of families. Pennsylvania does have some resources and not a ton, and especially not a ton for that under 18 group. So if there is an eating disorder, we're a great resource for it. There's something close. We're doing lots of virtual treatment also. So that's working. And then Kristin and I are both in Cleveland, the Cleveland area, where we do have those higher levels of care and not too far from you guys. So if something should come up, we've also opened an adolescent residential in Columbus. So that's in Ohio also, but glad to give you guys some things to look for.
Yeah, thank you so much. And again, the tips on looking at what your kids are doing, or asking those questions in a different way, were just really, I have a 5-year-old, so it's always we have eating conversations every moment of every day. So just thinking about how to reframe those.
Yeah, and the thing I always tell every parent is like, your kid best. Like, we may know eating disorders, but like, your child. So like, if something seems different or off, follow that instinct. So like, if your kid's always not liked like mashed potatoes and they don't want to eat mashed potatoes, okay, like they've never liked it, it's fine. But if your kid used to like love your mac and cheese and now all of a sudden they're like, I don't like that, or I don't want that, that might be something that might just be something to ask about, get curious about. Just be like, hey, this just seems like not your typical kind of thing. Like, what's going on here? So again, just kind of being curious about it, keeping an eye on it, just hoping that we can get that intervention as soon as possible.
Yes. Thank you. Thank you again. If anyone has any further questions, I'm sure Kristin's contact information is in the PowerPoint. Please feel free to, everyone that is in attendance, feel free to share the information about the session. It'll be on YouTube. And yeah, thank you again for joining us. Have a great night.